Hello, everyone. Chris Ruhm with the Ruhm-Insurance Agency, licensed independent insurance agent located in Cincinnati, Ohio. Currently hold a license in 18 states. Today, we are going to discuss the Medicare annual election period and why you might want to review the plan you have. The annual election period is October 15th through December 7th. And if you have any questions after watching this, please reach out to me by calling or texting me at 513-496-3877, or you can contact me through a couple means on my website at chrisroom.com. So here are your options if you want to review your plans. You can stay put. If you're happy with your plan, 99% of the time you don't need to do anything. You'll receive an annual notice of change. If nothing is of concern, stay put and everything is status quo. However, you can review your Medicare Advantage, prescription drug, or Medicare supplement or Medigap plan. Okay, and we'll go over briefly why you might want to do that. Why would you review your Medicare Advantage plan? Well, you might not know if you have an HMO or PPO. That's a pretty good thing to know because the cost sharing is significantly different and there are many good HMO plans out there. Does your plan have a premium? There are so many zero premium plans. There is really no reason to have a plan with a premium. If you're going to have a premium on a Medicare Advantage plan, I'd highly encourage you to look at a Medicare supplement plan because of this right here. This is the biggest negative with Medicare Advantage plans. Is if your network changes. These are HMO and PPO managed care plans. So what can happen is your doctor or your entire network can leave the plan. We just had a major dispute with a huge hospital and huge Medicare plan in Cincinnati. It went down to the wire. It was resolved like they mostly are, but sometimes they aren't, and it can leave you hanging mid-year without your doctor or hospital, skilled nursing facility, pharmacy, whatever in network. So if that happened to you this year or any year, this is a time to look up a new plan, again, because there are no questions asked, and you can switch to a new plan during this time of the year. And then often people want to just see if they can get better supplemental coverage. Maybe your plan doesn't have a really good dental, vision, hearing, transportation, over the counter benefit, where you can review plans to see if there's a better option out there. And then if any of your medications change, this can be a big one. You can switch plans to a different plan that has all your doctors and hospitals in it. And there might also be $1,000 savings on prescription drugs. So it's a really good reason to switch and review Medicare Advantage plans. Prescription drug plans, they come with Medigap plans or Medicare supplements. So you buy a Medicare supplement and then you get a standalone prescription drug plan. The reason you'd want to check these out, if your premium changed significantly for some reason, you started taking a new medication mid-year and you notice a huge cost increase, this is a great reason to do it. Or you've been on the same plan for many years and you didn't take any medications and you just got the cheapest plan and now you're taking one and it's changed. This is a good reason. And then if you haven't reviewed your plan, what I see people do is they'll buy a Medicare supplement plan from, let's say, United Healthcare, and then they buy the same prescription drug benefit from the same carrier, and they don't review all your options. I review every single carrier, whether I represent them or not. And if it can save you money, you can switch over to the new Medicare supplement plan. And like I said, I've seen big changes in premiums and cost sharing because people just didn't know that all those options were out there. So I will review all those options. Again, whether I'm appointed with them or not, I'll run you through the Medicare site and make sure you have the best plan for you, not the one that the insurance agent or company sold you and they didn't review all the options. And then last, if you have a Medicare supplement plan or Medigap plan, you can keep these plans forever. There are no Medicare annual election periods or anything like that. It's just a good time to review these plans and start fresh for the new year if you wanted to make a change. Okay. But these plans are medically underwritten after your initial election period, which is 6 months from your Part B effective date typically. So again, if you have no idea what Medigap plan you have, it's a good reason to review it. If you have plan F or G and it's expensive and you're sick of paying the high premiums, I never sold F unless somebody just insisted on it. But plan G has a little bit of cost sharing, but the cost sharing difference and the premium difference offsets the benefits that you get for plan F. So I always sold G if somebody wanted the richest plan. And then There are two other great plans that you might not have heard of. Plan N and high deductible G. These high deductible G's very rarely brought up by agents just because, you know, you can get a plan for under $50 a month, anywhere from $30 to $50 a month. We make a commission on a percentage, so people don't bring this up because either they don't understand it, agents don't bring it up because they don't understand it possibly, or they don't want to make $5 a month when they can sell a plan G or F and make $25 a month. I don't care. I love high deductible G personally, if you followed any of my other videos. So if you haven't heard of high deductible G and you're in good to excellent health, give me a call and we'll discuss that. And then one other option, I told you that Medicare supplement plans can medically underwrite you. Well, let's say you're not eligible due to a health condition. Well, if you've never tried a Medicare Advantage plan, they have a Medicare Advantage trial, right? Where you can go into this plan for 1 month up to a year. And if you're not happy at any point, you can go back to your Medicare supplement plan carrier that you had with no health questions asked. If that plan is no longer offering Medicare supplements to new beneficiaries, you can switch to another carrier without any health questions as asked. This could be a tool that you put in your back pocket if you're not healthy enough to switch and your premiums are excessive. So we'll just talk about that if this is your situation, but that's one reason to review this time of the year. So I appreciate you guys taking time to watch this today. I would love if you subscribe to my page and like this video. Again, you can visit my website at chrisruhm.com. I added my Medicare page here with some additional information on Medicare, and I would love for you to fill out a needs assessment request, and I will send you a link where you can fill out all the details necessary for me to give you an adequate review that I think will make you aware of what you have and if there are better options for you. So again, give me a call, text, visit my website, and we will be in touch and hopefully be able to save you a little bit of money. Thanks a lot and have a great day, and I appreciate you watching. Bye-bye.